Hello everyone, welcome back to the channel. Today we will be talking about anxiety. What is anxiety? Anxiety is a normal response to stressful situations that we face every day. It is supposed to protect us from the dangers and keep us alert and attentive to the situations we are put in. However, you got to distinguish between normal anxiety and having anxiety disorders. Anxiety disorders are an unhealthy way of viewing the world around you. Anxiety refers to the anticipation of a future concern and is more associated with muscle tension and avoidance behavior. It is one of the most common mental disorders that can affect adults with about 30%. Sometimes it can hinder the individual from leading a normal life depending on the severity of the anxiety. But don't worry, anxiety disorders are treatable, and several effective treatments are available. Treatment helps most people to lead a normal, productive life. But what causes a person to have anxiety disorders? Anxiety disorders appear to be caused by an interaction of biophysiosocial factors. Genetic vulnerability interacts with situations that are stressful or traumatic to produce clinical significant syndromes. These may be some causes linked to having anxiety disorders, but are not limited to medications, bad childhood experience, trauma, having anxious parents, having low testosterone if you are a man, having low iron in the blood, or thyroid imbalances. So what are the types of anxiety? There are different types of anxiety, which can include generalized anxiety disorder. This usually involves excessive worrying about almost anything and everything, such as school, work, or other events. This is diagnosed as generalized anxiety disorder when it occurs multiple days over the previous 6 months. It is usually associated with restlessness, tension, which can be manifested as tension in the shoulders, butterflies in the stomach, and worrying thoughts going through the mind. Second type is social anxiety disorder. This type of anxiety involves intense worrying about getting humiliated, judged, or being made fun of in a social situation. Examples might include avoiding eating or drinking in public, avoid meeting new people, or extreme fear of public speaking. Agoraphobia. It is an intense fear of not being able to find an escape route that can cause excessive, unreasonable fear. This might include fear of public transport, fear of elevators, fear of being outside the home alone. Fourth type is panic disorder. This involves recurrent and unexpected panic attacks, which might include intense fear, palpitations, shortness of breath, tremors, and sweating. Some people describe it as having a heart attack. It can be followed by at least 1 month of persistent worrying about future attacks, or worse, avoiding places where you had your attack. The last type is separation anxiety. A person with a separation anxiety disorder may be persistently worried about losing the person closest to him or her, may be reluctant or refuse to go out or sleep away from home or without that person, or may experience nightmares about separation. Physical symptoms of distress often develop in childhood, but symptoms can carry out through adulthood. Now, what are the effective ways to deal with anxiety? There are 3 ways you can deal with anxiety disorders. The first one is cognitive behavioral therapy, or CBT. An important first step in overcoming a psychological problem is to learn more about it. Learning about your problem can give you the comfort of knowing that you're not alone and that others have found helpful strategies to overcome it. You may even find it helpful for family members and friends to learn more about your problems as well. Some people find that just having a better understanding of their problems is a huge step towards recovery. CBT involves relaxation strategies. Learning how to relax your body can be a helpful part of therapy. Muscle tension and shallow breathing are both linked to stress and anxiety, and sometimes depression. So it's important to become aware of these bodily sensations and to regularly practice exercises to help you learn to relax. The two strategies often used in CBT are calm breathing, which involves consciously slowing down the breath, and progressively muscle relaxation, which involves systematically tensing and relaxing different muscle groups. As with any other skill, the more these relaxation strategies are practiced, the more effectively and quickly they will work. Other helpful relaxation strategies include listening to calm music, meditation, yoga, and massage. It's important to realize, however, that the goal of relaxation is not to avoid or eliminate anxiety, because anxiety is not dangerous, but to make it a little easier to ride out these feelings. Realistic thinking. Effectively managing negative emotions involves identifying negative thinking and replacing it with realistic and balanced thinking, because our thoughts have a big impact on the way we feel. Changing our unhelpful thoughts to realistic or helpful ones is a key to feeling better. Realistic thinking means looking at yourself, others, and the world in a balanced and fair way, without being overly negative or positive. Facing fears. Exposure. It's normal that you want to avoid the things you fear, because this reduces your anxiety in the short term. For example, if you are afraid of small enclosed places like elevators, taking the stairs instead will make you less anxious. However, avoidance prevents you from learning that the things you fear aren't as dangerous as you think. So in this case, taking the stairs prevents you from learning that nothing bad happens when you do take the elevator. In CBT, the process of facing fears is called exposure, and it's the most important step in learning to effectively manage your anxiety. Exposure involves gradually and repeatedly entering feared situations until you feel less anxious. You start with situations that only cause you a little bit of anxiety, and you work your way up to facing things that causes you a greater deal of anxiety. Natural supplements. The second way to deal with anxiety is by using natural supplements. They are alternative to drug prescriptions with fewer side effects if you want to try something else before prescription medications. There are 4 natural supplements that are usually recommended. Number 1 is ashwagandha. Ashwagandha is an ancient medicinal herb. It's classified as an adaptogen, meaning that it can help your body manage stress. It also provides numerous other benefits for your body and brain. For example, it can boost brain function, lower blood sugar, cortisol levels, and help fight symptoms of anxiety and depression. The second supplement is L-THEANINE. Theanine is an amino acid that is not commonly found in the human diet, as it's not one of the essential or non-essential amino acids. Theanine is found to be the relaxing but not sedating agent, and has been found to help process stress and to improve attention. It has also been found to aid in sleep quality. The third supplement is magnesium. One of the most abundant minerals in the body, magnesium, plays an important role in several bodily functions and has several health benefits. In addition to these benefits, magnesium may be helpful as a natural supplement for anxiety. The fourth one is omega fish oil supplement. Omega-3 fatty acids are found primarily in fish oil. Because depression appears less common in nations where people eat large amounts of fish, scientists have investigated whether fish oils may prevent and or treat depression. Conclusion: anxiety disorders are very common and can present in diverse ways. Because the condition is underdiagnosed and associated with high morbidity, it is best managed by an interprofessional team consisting of a mental health nurse, psychiatrist, psychotherapist, social worker, and primary care provider. And last but not least, remember that you are not alone, and many people are going through the same exact thing that you are going through, and they found their ways to manage their anxiety. Thank you for sticking till the end of the video. See you in the next video. Bye now.